So I welcome you all for today's session. A very good morning to all of you. So today we are going to start pharmacology. Okay, so in pharmacology, one of the important topic, ultra important topic for university exams also and for competitive exams also is antimicrobials. So we are going to start antimicrobials and pharmacology. Now listen, in pharmacology, I have a very unique way of teaching pharmacology. So I will teach you this antimicrobial section. Today we are going to discuss protein synthesis inhibitors in a very unique way by making master charts. In a comparative way, we will discuss the pharmacology. So in pharmacology, all the drugs are discussed in 8 patent headings. We will start with the introduction, mechanism of action, uses, adverse effect, resistance. So there is a fixed set of headings in which we describe all the drugs. And I will give you maximum mnemonics to understand the uses and adverse effects, and we will understand the mechanism of action with the help of the diagrams and flowcharts. So without wasting any further time, I guess I must start and I must come on the topic. And let's start pharmacology, the unique series of the pharmacology. Okay, give me a minute. That is protein synthesis inhibitors. Okay, let me start protein synthesis inhibitors. So before starting the protein synthesis inhibitors, one of the antimicrobial, you must understand what are antimicrobial drugs. Listen, I'm having a patient in my clinic. The patient is having certain infection. The infection is caused by the microorganisms. There are 4 types of microorganisms in this world. The microorganism can be a bacteria, can be a virus, can be a fungus, can be a parasite. They all cause infections in humans. Okay, so I'm having a patient in my clinic having one of the infection may be caused by a bacteria, virus, fungus or parasite. Now, being a doctor, I want to treat my patient. I want to cure my patient. So what I will do? If the patient is having bacterial infection, I will give antibacterial, antiviral, antifungal or antiparasitic drug respectively. Whatever I'm suspecting, based on that, we will give that particular drug. For example, the patient is having bacterial infection. We will give antibacterial. So what does this antibacterial will do? Antibacterial is a drug that will kill the bacteria. Antiviral will kill the virus. Antifungal kill the fungus. Antiparasitic kill the parasite likewise. So these all drugs that kills the corresponding microorganisms are known as antimicrobials. Antimicrobials are the drug that kill the microorganism. Either they kill it or they suppress the growth. They inhibit the growth of the microorganism. They are not always killing, or they are inhibiting the growth. So they can be bactericidal, they can be bacteriostatic. Okay, so these are antimicrobials. So basically what we are doing, we are giving a drug that is killing the bacteria in my patient's body. Okay, so what basically we are doing? We are doing the murder of the bacteria by giving a drug. So am I a murderer? So all doctors are murderer. Murderer of whom? The bacteria, the virus, the fungus, the parasites. Yes, we want to kill them because we want to treat the patient. Yes or no? But bacteria, virus, fungus and parasite do not want to get killed. No one want to get murdered. If someone will murder me, I will say save. Okay, please help. So bacteria also want to get saved. Virus, fungus, parasite. So for which they show the resistance. You know what is the meaning of the resistance? Resistance is something, they are resisting the killing. You are getting my point. They do not want. So they develop resistance. There are various mechanisms that I will explain you. So first understand the antimicrobial. Now let me tell you the classification of the antimicrobial first before coming on the particular category today. That is protein synthesis inhibitor. Protein synthesis inhibitor is one of the antimicrobial. These are antibacterial drugs. They kill bacteria. They all kill bacteria. They are antibacterial. One of the drugs that kill bacteria. So before that, you must understand all the categories. Okay. So any agent that kill the microorganism or inhibit the growth of the microorganism is known as antimicrobial agent. First, understand the definition. I hope you understood the definition. Now coming on the classification. Okay, first understand the classification, then I will come on the particular category today, that is protein synthesis inhibitor. I will tell you this in a very unique way. But before that, you must understand the classification. There are 6 ways to classify antimicrobial drugs. I will tell you all 6 ways, one by one. The best among them is based on the mechanism of action. The best. If you want to learn one, learn the classification basis, the 4th one, that is mechanism of action. But I will tell you all 6. The first, based on the chemical structure, they are divided into 18 groups. They are divided into 18 groups based on their chemical structure. Some of them have sulfonamides, some of them are diaminopyridamides, some of them are quinolones, some of them have beta-lactam rings, some of them have 4 rings, that is tetracycline, some of them have benzene with the nitro group. So don't learn it. Don't learn it. Just have a look. Just have a look. So this is based on the chemical structure. They are divided into 18 categories. Okay, they are divided. You must know, based on the chemical structure, they are divided into 18 categories. The second way of classification, based on the organism on which they are acting. As I told you, there are 4 types of microorganism: bacteria, virus, fungus, and parasite. So antibacterial kill bacteria, antifungal kill fungus, antiviral kill virus, and antiparasites are of 2 types, because we have 2 types of parasites, protozoa and helminths. The one which kill protozoa are antiprotozoal, and the one which kill metazoa, that is helminths, are antihelminthic. So these both are antiparasitic. Okay, so this is the classification based on the organism they are killing. The second way of the classification. I hope you are getting it. The third way of classification is based on their activity. How many types of bacteria you know? Huh? You may have read this in microbiology. There are 4 types of bacteria based on the gram staining. They are gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. So there are certain drugs that kill all. So these are known as broad spectrum. Broad spectrum is something that is killing all of them. But narrow spectrum have a peculiar, they kill only peculiar category. They do not kill all. They kill only peculiar. For example, penicillin kill only gram-positive. They do not kill gram-negative. They have less activity towards gram-negative as compared to gram-positive. So they are more active against gram-positive bacteria as compared to gram-negative. So they act against a peculiar category. So that is based on their activity, whether they are narrow spectrum or broad spectrum. So that is the third classification. The fourth classification is ultra important. That is based on mechanism of action. I told you, if you want to learn one classification, go with this one. Now listen, everyone on the screen. This is bacteria. This is the cell of bacteria. This is not human cell. This is the cell of bacteria. This is the nucleus of the bacteria. Okay. Inside the bacteria, this is the ribosome of the bacteria. This is the cell membrane and this is the cell wall. All bacteria have cell wall, whether gram-positive or gram-negative. All bacteria in this world except mycoplasma have the cell wall. Now, this bacteria, which you can see on the screen, this bacteria is present in my patient's body. So this bacteria is causing a disease in my patient's body. Okay, and being a doctor, I want to kill it because I want to save my patient, I want to cure my patient, I want to treat my patient. So I want to kill this bacteria which is present in my patient's body. So there are 4 ways I can kill it. I can give the drugs to kill that, antibacterial drugs. There are 4 ways I can kill this microorganism. Number 1, I can give the drug that act on the cell wall, and they inhibit the cell wall synthesis in the bacteria, so bacteria will die. The cell wall synthesis will be inhibited. The bacteria will swell, burst and die. So there are certain drugs which act on the cell wall synthesis inhibitors. Number one. The second category of the drug, they act on the cell membrane, not cell wall. They act on the cell membrane. They cause pores or holes in the cell membrane. They cause pores or holes in the cell membrane. Cell membrane means they cause pores or holes so that the cytoplasm or the vitals will leak out and the bacteria will die. This is the second mechanism we can kill this bacteria. The second mechanism we can kill this bacteria is this. The third mechanism, we can give the drugs which act on the ribosome. On the ribosome, protein synthesis takes place. So these drugs inhibit protein synthesis in the bacteria. The bacteria will not get killed, but the bacteria cannot divide because the protein synthesis is not taking place. So the third mechanism by which we can inhibit the growth of the bacteria is by giving the drugs that act on the ribosome by inhibiting the protein synthesis. And the fourth and the last mechanism, we can give the drugs that act on the nucleus and they inhibit the nucleic acid synthesis. Nucleic acid synthesis is inhibited by these drugs. They can be DNA inhibitors or RNA inhibitors. Synthesis of DNA inhibitors or RNA synthesis inhibitors. So these are the 4 broad mechanisms by which the drugs can kill the bacteria. Say yes if you got it. What are the 4 ways? Now this is the bacteria. You want to kill it with the help of the drug. So there are 4 drugs which can kill the bacteria. The first, acting on the cell wall. These are the drugs, they inhibit the cell wall synthesis. So the bacteria will get killed. The second are the drugs which cause pores in the cell membrane. They do not act on the cell wall. They cause pores in the cell membrane. So the bacteria will get killed because the cytoplasm will leak out. The third drugs, they act on the ribosome. They inhibit the ribosome. So protein synthesis will not take place and bacteria cannot divide. Okay. And 4 drugs, they act on the nucleus and they inhibit the DNA or RNA synthesis. So there are 4 drugs. Okay. Out of them, today I will teach you only one category, that is protein synthesis inhibitors. And here there are 4 main drugs that I will teach you in detail. Say yes if you all got it. Got it? So these are the 4 mechanisms. Cell wall synthesis inhibitors, cell membrane. They act on the cell membrane and causing pores in the cell membrane. protein synthesis inhibitors and nucleic acid synthesis inhibitors. Among them, we will study one today, that is protein synthesis inhibitors. How many of you got it? Give me a thumbs up. Got it? So this is the same diagram which I have explained you. You can see the bacteria. You can see these all are the drugs which inhibit the cell wall synthesis. Okay, one of them is beta-lactam. Beta-lactam antibiotics that I will teach you in the next session. Beta-lactams I am going to teach you in the next session. One of the drugs, they act on the cell membrane. One of the drugs that act on protein synthesis that we are taking today. And these are acting on the nucleic acid synthesis. So there are 4 ways. These are cell wall synthesis inhibitors. I am not reading the name. These are acting on the cell membrane. Today we are going to take protein synthesis inhibitors. How many of you got it? Today we are going to take protein synthesis inhibitors. So there are 7 protein synthesis inhibitors, out of which 4 are ultra important. I will teach you these 4 in a comparative unique manner. So I will teach you 4 chapters today. I will teach you tetracycline, aminoglycoside, chloramphenicol and erythromycin, that is macrolides. So I will teach you these 4 chapters today in a unique comparative manner. They all act on the ribosome of the bacteria. Now ribosomes have 2 portions, 30S and 50S. Some of them act on 30S, some of them act on 50S, some of them act on both. But ultimately, the purpose of all these drugs is same. They inhibit the ribosome, no protein synthesis. So bacteria cannot divide. They do not kill the bacteria. They cannot. The bacteria, there is a bacteria. You are giving one of these drugs. So that drug will go on the ribosome, inhibit either 30S or 50S or both. So ribosome will not function. So that bacteria cannot form protein, but that bacteria will not die. But that bacteria cannot divide further. It cannot do the binary fission because there is no protein synthesis. Got my point? So they all are bacteriostatic except aminoglycoside, which are both bactericidal as well as static. Got it? So some of them act on 30, some of them act on 50S, some of them act on both. I will give you the detail when I will teach you each one of them. Okay. And the last mechanism, some of them act on the nucleic acid synthesis, DNA or RNA. They inhibit DNA synthesis or RNA. This is the 4th classification. The 5th classification, some of them kill the bacteria. They are known as bactericidal. See how many bacteria you can see? You can see on this culture plate, few colonies are there. If you are putting a drug, they all get killed. They all get killed. This is bactericidal. Cidal matlab killing. Cidal means killing. And there are, you can count here, 1, 2, 3, 4, 5, 6, 7. This 7 are 7 only. The 7 remains 7. The number do not increase. So they are bacteriostatic. Static means they do not kill. They inhibit the growth. They inhibit the growth. So here, whatever is the number of the colony, the same number of colony is here. They are not increasing. They are not doing binary fission. Got my point? So they can be bactericidal. They can be bacteriostatic. Some of them are bactericidal. Some of them are bacteriostatic. And the last one, from where we are obtaining that particular antibiotic. Antibiotic from where we obtain? We obtain the antibiotic by genetic engineering, either by inside the fungus or inside the bacteria or inside the actinomycetes. So these are the broad 6 ways of classing antimicrobials. I taught you the definition of antimicrobial. What are antimicrobial drugs? Antimicrobial drugs are the drugs that kill the microorganism. They kill bacteria, they kill virus, they kill fungus, they kill parasite. So there are 6 ways to classify them. Based on chemical structure, there are 18 types. Don't learn that. Just have a look. Broadly have a look. You don't get question on them, but you get questions on others. Okay. The type of organism they are killing. So antibacterial kill bacteria, antiviral, antifungal, antiparasitic are of 2 types. Antiprotozoal and antihelminthic. They all are antiparasitic, both of them. Type of spectrum of activity. Based on spectrum of activity, they are of 2 types, narrow spectrum and broad spectrum. Broad spectrum kill all bacteria. Narrow spectrum kill particular category. I told you whether cocci or bacilli or gram positive or gram negative. Based on mechanism of action, I told you there are 4 mechanisms. I told you in detail. Based on type of action, they are of 2 types, bactericidal and bacteriostatic. And from where they are obtained, again they are divided in 3 categories, whether they are obtained from bacteria or from fungus or they are obtained from actinomycetes. So this is the broad classification. Now coming on my topic today. So this is the overview. Abhi to bhumika bani hai na? Now we will see the details of the topic. So can we start? Are you people ready? So this was the warm up. So can we run now? Can we start the marathon? The protein synthesis inhibitors among them. So I'm going to teach you 4 drugs. Tetracycline, chloramphenicol, aminoglycoside and macrolide antibiotics. The prototype drug here is erythromycin. So I will indicate tetracycline with T, chloramphenicol with C, aminoglycoside with A and erythromycin with E. So I am going to teach you these 4 drugs in detail today in a unique way. Okay. So let's start it. They all inhibit protein synthesis. Where does protein synthesis takes place? Now this is bacteria. This is the cell wall of the bacteria. I'm not interested in cell wall. I'm not interested in cell membrane. I'm not even interested in the nucleus. Where I'm interested? I'm interested in ribosome because protein synthesis takes place in ribosome. So these all drugs which I taught you, tetracycline, chloramphenicol, aminoglycoside, and erythromycin, they act on the ribosome because they all inhibit protein. So there are two sections in the ribosome, the 30S and 50S. So some act on 30, some act on 15, some act on both. So these all drugs act on the ribosome. But before understanding the mechanism, the step is different now. They all inhibit ribosome, the protein synthesis, but the exact step is different in all four. You have to understand that. But for understanding which exact step they are inhibiting inside the ribosome, you have to understand the steps of the protein synthesis. If you don't understand the step of protein synthesis, how you can understand the mechanism of action of protein synthesis inhibitors? तुम्हें पता ही नहीं है कि प्रोटीन बनता कैसे है बैक्टीरिया में, तो मैं कैसे बताऊं कि ये वाला एंटीबायोटिक कौन से वाले स्टेप को इनहिबिट करता है? You are getting my point. So first you have to learn the normal protein synthesis, the transcription and translation. You have read this in biochemistry also. I'm sure you have read this, but I'm revising your concepts. Okay. See, everyone on the screen. Can you see a bacterial cell? This cell is bacterial cell, not human cell. See, this is a bacterial cell. Okay. This is the nucleus. This is the nucleus of this bacteria. Okay. Inside the nucleus, this is the double-stranded DNA. Okay. Inside the bacteria, the bacterial cell, the nucleus, the DNA. We can see. Now, the two strands of the DNA are separating from each other. One is leading, one is lagging. So you can see these are the double-stranded DNA. Have a look. Have a look. Okay. Now the two strands are separating from each other. One is leading, one is lagging. So imagine this one is leading and this one is lagging. Okay. You have read all this. I'm just brushing up your concept so that you have a better understanding here. Got my point? Now on the leading strand, the mRNA is synthesized. You know, so one of the leading strand give rise to complementary mRNA. So this is known as transcription. This is known as transcription. Okay. What is transcription? Transcription is formation of mRNA from DNA. What does transcription say? It is formation of mRNA from DNA, from one of the strand of DNA, the complementary mRNA. It takes place in nucleus. Now I am going to teach you 4 drugs today. Now, what are the names? See ma'am, tetracycline, chloramphenicol, aminoglycoside, and the last one is erythromycin. None of them act on transcription. No, transcription is absolutely normal. They all act on the next step, translation. So transcription is absolutely healthy, absolutely normal. Now this mRNA is coming out of the nucleus. See the next diagram. See. Now the transcription is done. Okay, what is transcription? Transcription, this is DNA. This is leading strand of DNA, the blue color, from which the mRNA is synthesized. This is complementary mRNA. Now it will come out. Now this will come out of the nucleus. See, it is already came out of the nucleus. This was mRNA synthesized here. Now it came out of the nucleus and went on the ribosome. Now see the ribosome. Now it is going on the ribosome. Now on the ribosome, what will happen on the ribosome? The mRNA convert into the protein. Hana, you see. So from this mRNA, the protein is synthesized. So this is known as translation. So we have 2 steps. We have 2 things. What are the 2 things I told you? One is transcription, one is translation. Transcription takes place in nucleus. Translation takes place in cytoplasm. In the cytoplasm, in the ribosome to be specific. Okay. What is the definition? What is the definition, people? Huh? What is transcription? Say, ma'am, formation of mRNA from DNA. And what is translation? Formation of protein from mRNA. So first, from DNA, mRNA is formed inside the nucleus. Now this mRNA came out. It will go in the cytoplasm. It will go in the ribosome. On the ribosome, it will convert into protein. What is protein? A chain of amino acid. Amino acid 1, amino acid 2, amino acid 3. Likewise, multiple amino acid bind together and protein is formed. So this step is known as transcription. I'm not interested in that. This step is known as translation. I want to give you the details of translation, how exactly it happens. Because all my 4 drugs which I'm going to teach you today, that is tetracycline, aminoglycoside, chloramphenicol, and erythromycin, they all inhibit translation. By inhibiting translation, they inhibit the conversion of mRNA to protein, and in this way, they are protein synthesis inhibitor. To be crystal clear. Say yes if you got it. Everyone say yes. Can we go ahead? Can we go ahead? So you can see the mRNA which is coming out of the nucleus. Now it is going on the ribosome. Let me zoom the ribosome to explain you the structure of the ribosome. Let me zoom. So this is the zoom version of a ribosome. You can see this is a normal ribosome. In a normal ribosome, there are 2 windows. This is P window and this is A window. You can see in the ribosome, there are 2 segments, 30S and 50S. And there are 2 windows, P and A. Now let me take this mRNA and attach on this ribosome. So this is the mRNA attached on the ribosome. Can you see the blue color mRNA? So this mRNA is attached on the ribosome. You know mRNA have codons. What is a codon? What is a codon? Codon is the triplet of the nucleotide. है ना? So in the mRNA, multiple. This is first codon, this is second codon, this is third codon, this is fourth codon, likewise. So you can see the first codon always goes, C1, the first codon. It will always go on P window. It's the rule. And the second codon is going on the A window. It's a rule. So as soon as you can see this mRNA is coming out and going here, you can see the C1 is attached on the P window, see it, and C2 is attached on the A window, see it. Okay, you can see. Okay, now let me tell you how does the, now you know the codons, these all are codons. You know, these all are codons. You may have read this in biochemistry. I'm not teaching you this. You know, one codon, it is coding for one amino acid. There are 20 amino acids, but we have 64 codons. You got my point? So there are multiple codons you can see. They are coding for one amino acid. They all code for one specific amino acid. You can see. So you can see one codon is standing for one amino acid. Say yes if you got this concept. You may be knowing now. Now see the cytoplasm. You see this bacterial cell. See this bacterial cell. See the nucleus. See the ribosome. On the ribosome, you can see this is codon 1. It may be standing for one amino acid. There are 20 amino acids, they all are present in the cytoplasm. Can you see the cytoplasm? Can you see the amino acid? This is amino acid 1, this is amino acid 2, amino acid 3, 4, 5, 6, 7, 8. They all are present in the cytoplasm. They are not alone. They are present on tRNA, transfer RNA, tRNA. So tRNA is transporting them. So it is tRNA. They are present on tRNA. So all the amino acids are present in the cytoplasm on tRNA. Got my point? Now they all are present. So whatever C1 is standing for, there will be a call for that amino acid. Wherever you are, please come here on the ribosome. For example, this C1 is this, CUG. So wherever is the leucine present in the cytoplasm, it will come. If the first amino acid is UCG, wherever is the serine, wherever it is, it will come. You got my point? So all the 20 amino acids are present in the cytoplasm. Whatever codon is coming on the P window, that particular amino acid for which it is standing, it will go and bind there. So this is the rule. So let me tell you the 4 steps in translation. I will teach you 4 antibiotics. Tetracycline, Chloramphenicol, Aminoglycoside and Erythromycin. They all will inhibit one step. There are 4 steps and they all will inhibit one step. So mechanism of action of all of them is different. The particular step is different. So you have to understand the 4 steps. So what is the first step? The first step, please understand the first step. You can see whatever amino acid, the C1, whatever codon is there, the C1 on the P window, the first amino acid standing for that, it will come and bind on the P window. This step is known as initiation. So whatever codon is present on the P window, the particular amino acid present in the cytoplasm, that will come and bind on the P window. So this step is known as initiation. It always takes place on P window. It starts at the P. The initiation takes place at P. Say yes. The second amino acid, which is for second codon, it will come and bind with the A window. This is second step. The second step. This is the initiation, which happens at P window, in which the amino acid come and bind at the P window. This is attachment of new amino acyl tRNA, the new amino acid containing tRNA. It will come on the A window. So first step takes place on P window, second step takes place on A window. This is known as old amino acid. This is known as new amino acid. On P, it's always old. Old means previous. And on A, it's always new. It's a rule. Okay. Now what is the third step? In the third step, these 2 amino acids bind with each other. They will form peptide bond, and the old will go over the new. Old will go over the new. That is the third step. The first step, the amino acid come at P and bind at P. This is initiation. This is step number 1. The second step, the amino acid will come at A and bind at A. This is the second step. Now the third step, they bind. This is pre-existing. This is new. There is a bond formation between the two. The third step. There is a bond formation between the two, and the P will shift on the A. A will not come on P. The P will come on A. I mean the previous will come on the new, over the new. So A1 will come on A2. Peptide bond formation between the two, and it is shifting. So transfer of the peptide chain. So this is the third step. So what are the 3 steps till now? So first amino acid coming at P, the second amino acid coming at A, the third amino acid, not third, the 2 amino acids are binding with each other with peptide bond, and the previous is shifting on the new. It is known as P to A shift. It is known as P to A shift. P to A, not A to P, mind my words. It is P to A. You are getting it? And the last and the 4th step, please understand it well. It's difficult. The complete ribosome. Can you see the red color ribosome? Let me show you. This red color ribosome, it is shifting ahead by 1 codon. It is shifting ahead. So P window will come on A. A will go on the next codon and this codon will free. Shall I repeat or you got it? What I'm saying? So P will jump one codon ahead. A will, so that is P will come on A. A will also jump one codon ahead. Initially A is on C2. Now A will go on C3 and C1 will be free. See the next diagram. See the next diagram. You got my point, huh? But the chain of the amino acid will remain there only. Listen, listen, listen. The chain of the amino acid will remain there only. Where is the chain of amino acid? Now the chain of amino acid is on A. But now when this ribosome is going ahead by one codon, so P is coming on A. So this chain will come over the P. Can you see? Chain वहीं के वहीं है. Chain नहीं जा रहा. Ribosome एक codon आगे jump कर रहा है. Ribosome is moving by one codon है and this is known as translocation, the fourth and the last step. Got my point? Now the process start again. Now P window pe already we have amino acid. Now A window pe the A3 will come. A3 will come, then again peptide bond formation, then again P to A shift. है ना? This last step in which the complete ribosome is shifting, it is known as A to P. Because here the amino chain, the amino acid chain, it is shifting from A to P. It is shifting from A to P. So can you tell me the 4 steps? What are the 4 steps of translation? 1, 2, 3, 4. If you understand the 4 steps, it's very easy. What are the 4 steps? The first step is initiation. What is initiation exactly? Say, ma'am, binding of amino acid at P window. What is the second step? Coming of new amino acid at A window. What is the third step? The bond formation between the previous and the new. That is peptide bond formation and P to A shift. P to A shift. The previous will shift on the new. And last one, the complete ribosome is shifting ahead by one codon, that is known as translocation. Translocation means one codon jump and it is A to P. This one is A to P. Say yes if you got it. Say yes. Do you have any confusion over here? Do you have any confusion? Say yes if you got it. So I'm going to teach you 4 antibiotics now. Aminoglycoside inhibit this step. It inhibit P window. Okay. Tetracycline inhibit A window. Okay. Chloramphenicol inhibit P to A. Okay. And last, Erythromycin inhibit A to P. That's it. That was that easy. But ultimately, all of them inhibit translation. All of them inhibit protein synthesis. I don't know how many of you got it. Say yes if you got it. Okay. So do you have any confusion? Do you have any confusion? So I am going to teach you four antibiotics. You see, aminoglycoside inhibiting the first step. That is P window. It is blocking P window. So first step do not take place. It inhibit initiation. A is the first letter in alphabet. Na? A, B, C, D. A is the first letter. So it inhibit initiation. You can learn like that. A for aminoglycoside. It inhibit initiation. The first step. Okay. The second is the tetracycline. Tetracycline inhibit second step. It inhibit A window. The third is the chloramphenicol. It inhibit P to A. Peptide bond formation and P to A shift. And last one is erythromycin. It inhibits the translocation. That is A to P shift. How many of you got it? So that is the ultimate diagram. If I explain you directly, you don't understand, but now you can understand all 4. What is this first antibiotic? This one is aminoglycoside. It is inhibiting P window. See the cross. It is inhibiting P window. Can you see this one is inhibiting P window? Can you see this one? This one is the second one, tetracycline. It is inhibiting the A window. This one is chloramphenicol. This one is inhibiting P to A. And this one is erythromycin. It is inhibiting A to P. Say yes. Give me a thumbs up, everyone. Give me a thumbs up, everyone. Does anyone have any doubt? I repeat my words. P window, A window, P to A, A to P. P to A shift, A to P. Now you can understand. Now tell me which antibiotic is acting at which level. So this P window is blocked by aminoglycoside. That is initiation. A window is blocked by tetracycline. That is binding of new amino acid on A window. P to A shift is blocked by chloramphenicol. That is peptide bond formation between the new and the previous one and shift of previous to new. So this step is blocked by chloramphenicol. And the last one, erythromycin, it is inhibiting A to P shift. That is, it is inhibiting the translocation, jumping off one codon by the ribosome. This step is inhibited by erythromycin. I hope it's crystal clear. Does anyone have any doubt? Shall I repeat or you got it? Now, let's start the antibiotic. So let's start the actual chapter now. Can you see the 4 antibiotics which I'm going to teach you? In the sequence only I will teach you. Tetracycline, chloramphenicol, aminoglycoside and erythromycin. I will teach you in this sequence only. Got it? Give me a minute. I cannot see your chat. I can see now. So I will teach you the introduction in which I will tell you the structure of the antibiotic or any important point. Then the classification, spectrum, mechanism of action, resistance mechanisms, adverse effects and uses. For adverse effects, I will give you 4 mnemonic. For uses, I will give you 4 mnemonic. So at the end of the chapter, you will be having 8 mnemonics with you. You will be having 8 mnemonics with you. You got it? Can we go ahead? Can we start? Say yes. Can we start? So in this sequence only, and we will fill this table. Hannah, I request the students to take out your notebooks and pen and start filling it. Or otherwise, it is provided in the notes. Okay, so let's start with the tetracycline. Let's start with the tetracycline. Why tetracycline are known as tetracycline? Have you ever thought? Tetracycline are known as tetracycline because they have four nucleus, 4 cyclic nucleus. That's why tetracycline, the 4 benzene rings are there. That's why they are known as tetracycline. So in the introduction, you must know their structure. That's it. Coming on their classification. Tetracyclines are of 3 types. They are divided in 3 groups. Group 1, Group 2, Group 3. In the Group 1, we are having 3 tetracycline. Tetracycline is the class. It's a category. Tetracycline, inside which there is a drug known as tetracycline. So inside the category tetracycline, there is a drug tetracycline also. So the category 1 contain, Group 1 contain tetracycline, chlortetracycline and oxytetracycline. One is simple tetracycline, one is chlortetracycline, one is oxytetracycline, one is simple tetracycline. This Group 2 contain demaclocycline and lamicycline. And Group 3 contain doxy and mino. Okay, so you have to learn this classification. So it is divided into 3 groups. Group 1, 2, 3. Can you tell me the names? Total 7 drugs are there. In the Group 1, it's tetracycline, chlortetracycline, oxytetracycline. In Group 2, it's demaclocycline and lamicycline. And in Group 3, it's doxycycline and minocycline. Without any confusion, learn the 7 names. The mechanism of all of them is same. The category is tetracycline itself. Say yes if you got it. Say yes. So the classification is done. Coming on the spectrum, we are having 4 types of bacteria: gram-positive, gram-negative cocci, gram-positive and gram-negative bacilli. So where does it act? It acts on all. Gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative. It's a broad spectrum. Gram-positive bacilli, gram-negative bacilli. Not only on bacteria, it acts on mycoplasma, actinomycetes, rickettsia, chlamydia and protozoa also. So it is acting on gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli, spirochetes, rickettsia, mycoplasma and protozoa also. Because these 3 bacteria are included in none of the category. They are miscellaneous bacteria. So along with the 4 categories of the bacteria, they act on miscellaneous also. And not only bacteria, they act on some protozoa also. So please learn, it's the broad spectrum antibiotic. It is acting overall. So this is the spectrum, the simplest way to learn the spectrum. Coming on mechanism of action, I guess everyone knows. What is the mechanism of action? Of course, they all 4 inhibit protein synthesis. But which step? There are 4 steps, na? So tetracycline inhibits step number 2. That is, it acts on A window. It blocks the A window, not P window. Aminoglycoside inhibit the initiation, step number 1. They block the P window. Chloramphenicol inhibit the 3rd step, that is P to A shift. And the erythromycin inhibit the step number 4, that is A to P. Now you can understand because I have given you an overview. Say yes if you got it. So I guess everyone knows the mechanism of action. So this inhibit protein synthesis. But which step? Step number 2. That is, it do not block P window. The initiation is normal, but it blocked A window. So the new amino acid cannot come. So the tetracycline enter inside the cell, go on 30S of the ribosome. You have to learn it acts on 30S. And it blocked the A window. No A window, so second step will not take place. The new amino acid cannot come. Okay, so the protein synthesis cannot take place. Say yes. So please write down, it act on 30S, not on 50S. It blocks step number 2. That is, it blocked A window. And this one is bacteriostatic. Please learn the summary. Okay, and you can draw this flowchart, you can understand this diagram well. Now coming the various ways of resistance, we can skip. Coming on the adverse effect. What are the adverse effects of tetracycline? Give me a mnemonic. What is the adverse effects? The adverse effect is, the mnemonic is LK ADVANI PT teacher. LK ADVANI is PT teacher. So L stand for liver damage. They cause liver damage. K stand for kidney damage. They cause liver damage. They cause jaundice and cholestasis. They cause kidney damage also. Okay. A stand for anti-metabolic effect. D for diabetes, but not diabetes mellitus. It's diabetes insipidus. Okay. V is vestibular toxicity. Patient have vertigo. Chakkar aayenge. Vestibules are damaged. Okay. Vestibular toxicity. I is standing for intracranial pressure raised. PT, phototoxicity. And teeth and bone are damaged. And teacher ka one more T is teratogenic. We will say it's easy. LK ADVANI. You write down like this. ADVANI or ADVI. You can learn ADVI. LK ADVI, PT teacher. LK Advani, PT teacher. Say the full form. Say the full form with me. Can you try? Liver damage, kidney damage. Okay. A is anti-metabolic effects. What is D? Diabetes insipidus. Patient have multiple frequent urination. Vestibular damage, patient have vertigo. Increase intracranial pressure. Phototoxicity in the eyes. On the skin, I'm sorry. Phototoxicity. In presence of sunlight, there will be skin rashes will be there. Phototoxicity. T is teeth and bone damage, and T is teratogenic. If taken during pregnancy, it is teratogenic for the fetus. Never give tetracycline to any pregnant female. It is teratogenic. Can you say it again? LK Advani or Advi. PT teacher. Now you can say the full form, and you can understand the meaning of that. These are the adverse effects. Now coming on uses. Tetracycline is first choice in how many infection? So I'm having a mnemonic again. The mnemonic is vacuum the bedroom. Vacuum. V stand for Vibrio. It is the first choice of drug given in Vibrio cholera. Whenever the patient is having cholera, you can give tetracycline as first choice drug. A stand for acne. You know acne. Acne is also caused by a bacteria. So you can give tetracycline as first choice of drug. C is chlamydia. Also, you can learn chlamydia. The LGV and granuloma inguinale. The LGV caused by the chlamydia. Okay. U is ureoplasma. M is mycoplasma. Ureoplasma, mycoplasma, bhai. Ureoplasma, mycoplasma. T, the का जो T है, tularemia. Tularemia is plague. Plague, tularemia, plague, one and the same thing. Bad room. So Borrelia and Rickettsia. We will say vacuum. Vacuum में only one C is there. Vacuum the bad room. Vacuum the bedroom. Try to say tetracyclines are first choice of drug in Vibrio cholerae, acne, chlamydia, ureoplasma, mycoplasma, bhai, ureoplasma, mycoplasma, tularemia. Tularemia is plague, Borrelia and Rickettsia. Say, try to say. So, can you tell me the both things together? Adverse effects and uses. Can you tell me together? Tell me the adverse effects. We are talking about tetracycline, by the way. Don't forget that. We are talking about tetracyclines. Don't forget that. Tell me the adverse effects. Try to say LK Advi. PT teacher. Okay. And tell me the uses. Vacuum. Only one C, not double C. I know vacuum spelling have double C, but here you have to write down one C. The bad room. Now, I hope you can say the full form. Just say it once. Okay, you will understand. What are the adverse effects? Liver damage, kidney damage, anti-anabolic effects, diabetic insipidus, vestibular toxicity, intracranial pressure is increased, phototoxicity, teeth and bone damage, and teratogenic. Now, say the uses. Try to say it once. Vibrio cholerae, first choice. Acne, first choice. Chlamydia, LGV, first choice. Ureoplasma, mycoplasma, first choice. Tularemia, Borrelia, Rickettsia, first choice. So tetracycline is given as a first choice drug in these. So this is the summary of the tetracycline. So you have to learn complete pharmacology like this. This is a way. So today I'm teaching you a way how to read, how to understand pharmacology. It's very interesting subject if you do like this, all the drugs. Imagine all the drugs in entire pharmacology, you're tabulating like that. So these are the master's tables. At the end, the complete book of the pharmacology will get compressed in few 20-30 pages in which only tables are there. So we are compressing the complete pharmacology in just 20 pages. You can do so by making the comparative tables in entire pharmacology. This is the way you should study pharmacology. How many of you got it? So let's revise tetracycline and move on the second drug. So why tetracyclines are known as tetracycline? Because they have 4 benzene rings. That's why tetra means 4. What is the classification? They are divided into 3 groups. In each group, in the first group, we are having 3 drugs. Tetracycline, chlortetracycline, oxytetracycline. In the second, we have demeclocycline and lamicycline. And in the third, we have doxycycline and minocycline. So total 7 are there. 3 plus 2 plus 2. Spectrum, it's a broad spectrum. Acting against gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. What is the mechanism of action? It inhibits protein synthesis. Obviously, that is my chapter today. They all inhibit protein synthesis, but it is acting on 30S. It is acting on 30S. Okay, so you will compare which one is acting where. Okay, this one will act on 50S. This one is again acting on 30S. This one will act on both. So you will have a comparative overview that which drug is acting on which segment of the ribosome. Okay, this is inhibiting step number 2. That is inhibiting window A. A window. And it is bacteriostatic. Okay, the adverse effect is LK Advi is a PT teacher and uses his vacuum bedroom. Vacuum the bedroom. Okay, now coming on the second drug, chloramphenicol. Okay, so can I start chloramphenicol? Let's start it. Chloramphenicol, see the structure. It is having benzene with a nitro moiety. So the nitrobenzene, it is known as nitrobenzene, and that's why that will give the antibacterial activity here. Now compare the structure. Here tetracyclines are known as tetracycline because they have 4 rings, and chloramphenicol have a nitro moiety in a benzene. This should be a benzene. It is having a nitro moiety in the benzene. So here the 4 rings are responsible for antibacterial activity. Here the nitrobenzene is responsible for antibacterial activity. Now don't go in the detailed structure. No. We are not reading chemistry. Come on, we are reading pharmacology. So the basic thing on which the MCQ can be framed, you should learn that. So that is the structure. Now see the class. We don't have any classification. We have only one drug, chloramphenicol. Here we have 7 drugs. I told you all 7. Here we have only one drug, chloramphenicol. So classification is skipped. You don't have. What about the spectrum? Exactly same. The spectrum is same. It's also broad spectrum, acting against gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. Not only these, it is acting for spirochetes, rickettsia, mycoplasma, and chlamydia also. So it is same. So gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli, spirochetes, rickettsia, mycoplasma, protozoa. So spectrum is same. Both of them are broad spectrum. These both will be narrow. I will tell you why narrow. I will tell you, but you can see it's same. Now, tell me the mechanism of action. The first thing, this one was acting on 30S, this will act on 50S. The first thing, it is acting on the 50S. Hana? This one was blocking A window. That is second step. This will block the third step, A to P transfer. I'm sorry, P to A transfer. The P to A transfer. Can you see? P to A transfer. So this is the amino acid on P. This is the amino acid on A. Normally they form peptide bond with each other. And after forming peptide bond, the P is shifted on A. P to A shift. P window to A. This is blocked by chloramphenicol. The third step. So it is blocking step number 3. Say yes if you got it. So it is blocking step number 3. Got my point? So that is the mechanism of action. It inhibits protein synthesis. Step number 3, that is P to A shift. It do not block P, it do not block A. It blocked P to A shift. It blocked P to A shift. Okay, this one was blocking A window. This one is blocking P to A shift. There is a difference. There is a difference in that. So please understand. Okay, so it is inhibiting the peptide bond formation between the 2 amino acid and shift of the previous amino acid to the new amino acid. That is P to A shift. It is blocking P to A shift. Okay, so now please compare. Please compare. Can you see? Now see the structure of both of them. Compare. We are comparing tetracycline with chloramphenicol. Here total 7 tetracycline are there. Here only one drug, chloramphenicol, no classification. See the spectrum is same for both of them. But the mechanism of action is differing. Please have a look. Please, I request. This one is acting on 30S, tetracycline. Chloramphenicol act on 50S. This one is inhibiting step number 2. That is inhibiting A window. This one inhibiting step number 3. That is peptide bond formation and P to A shift. P to A shift. This is also bacteriostatic. This is also bacteriostatic. Okay. Now coming on adverse effect and uses. I will give you 2 mnemonics now. One for adverse effect, one for uses. So the adverse effects of chloramphenicol, the mnemonic is big super hypersensitivity. This is a mnemonic. Okay. B stand for bone marrow depression. It causes bone marrow suppression. What is bone marrow suppression? You know, inside the bone marrow in pathology, you may have read that we have hematopoietic stem cell. Do you know that? Hematopoietic stem cell give rise to RBCs. It gives rise to platelet and it gives rise to WBC. It gives rise to all the blood cells. That is, it is the ancestral cell. So basically chloramphenicol, if you give chloramphenicol to anyone, chloramphenicol, the patient is taking by mouth, tablet. Okay, it will get absorbed, it will go in blood. From the blood, it will go in bone marrow and it kill hematopoietic stem cell. So no RBC synthesis, no platelet, no WBC. Patient will have pancytopenia. Come on, it's a dangerous drug. That's why it is banned nowadays. Okay, pancytopenia. Only on rare cases we give, otherwise in combinations it's banned in India. We cannot give because it's a dangerous drug. The side effect is very, very dangerous. You know, the patient can have pancytopenia. Because of anemia, patient can have lethargy. Because of thrombocytopenia, patient can have bleeding disorders. And because of leukopenia, patient can have recurrent infections. So these are the side effects. Hana, bone marrow depression is a very severe or dangerous side effect. We cannot afford that. I stand for irritative effect. If you give by mouth, I mean oral, the patient will have nausea and vomiting. And patient can have diarrhea also. And if you give injection, patient will have pain. So wherever route you are giving, it is irritating that route. You are giving oral route, patient have vomiting and diarrhea. If you are giving injectable route, patient have pain. So irritation. Hana, G stand for grey baby syndrome. Very important. Never give chloramphenicol to a newborn, to a neonate, to an infant. Because if you give, the patient will have cyanosis. Patient will have pancytopenia. Hana. And because of the pancytopenia, the newborn can have toxicity because it is not very well metabolized by the newborn, and the newborn will have toxicity. Patient can have cyanosis, and this is known as gray baby syndrome. Super is super infection. Why super infection? Patient have pancytopenia, patient have less WBC. So recurrent infections, super infections are common. And hypersensitivity. Hypersensitivity allergies are common. So big, B-I-G, super hypersensitivity. This is the mnemonic. It is bone marrow suppression. Okay. Irritative effects. Okay. Gray baby syndrome. Super infection and hypersensitivity. This is the adverse effect. Coming on uses. I told you uses is highly restricted because of fatal toxicity. Usually it is given only when required. Otherwise try for alternative. If you have a better drug than chloramphenicol, don't give chloramphenicol. We give it on rare of the rarest occasion when no other drug is either available or it is non-functional. Otherwise, we never give it. Because of fatal toxicity, I'm talking about bone marrow toxicity. We never give it. We give it only on 6 occasions. The mnemonic is bare TB. B for bacterial meningitis or pyogenic meningitis if it's not responding to other drugs. This is not drug of choice. This is not drug of choice. A for anaerobic infection. R for rickettsia. E for ear and eye infection. That is endophthalmitis and conjunctivitis. Okay. T for typhoid and B for brucella. But it is not drug of choice in any of them. We give different drugs. If they are non-functional, then we will give this. If they are not working. Say yes if you got it. Say yes. Okay, got it. Thank you. Thank you so much for the compliment. Okay, so can we go ahead? Can we go ahead? So this is the uses. So please now compare the adverse effect of tetracycline with chloramphenicol and compare the uses of tetracycline with chloramphenicol. Read the mnemonics. Read the mnemonics. So can you say it once? The chloramphenicol adverse effect and uses. Huh? Okay, say it. Say both. Tetracycline, chloramphenicol. Tell me the adverse effects. Here the adverse effect is LK ADVI. ADVI. PT teacher. And here the adverse effects big, super, hyper, big, super, hypersensitivity. Tell me the uses of both. Here the uses is vacuum, the bad room. And here the use is bare TB. Bare TB. Okay, now can you tell me the full forms? Huh? Here I'm not saying, I have said once. Now here I'm saying the full forms. I guess it's okay. Huh? So B for bone marrow toxicity, never forget, because of which it is banned nowadays. I for irritation. G for gray baby syndrome, on which maximum MCQs come. Gray baby syndrome is caused by, answer is chloramphenicol. S is super infection and H is hypersensitivity. Super infection, hypersensitivity. It is never first choice drug. Never. It is given as an alternative. If the first choice drug is non-working or resistance, then only we afford it. Otherwise, we cannot give it. Hana, so what is the mnemonic? What is the mnemonic? Bare TB. What is the full form of bare TB? B for bacterial meningitis. And here B is for brucella. There are 2 B. Bacterial meningitis, pyogenic meningitis and brucella. Anaerobic infection, rickettsia, ear and eye infection, typhoid. But it is not first choice. Here tetracycline is first choice. Here it is not a first choice. I am saying that. I am insisting that. Got it? So this is the way you should learn pharmacology. We are done with 2 drugs till now. Tetracycline, chloramphenicol. Please understand, mechanism of action is something you have to understand in flowchart and diagram. If you are preparing for second Prof university exam, you have to draw the diagram here and you have to draw the flowchart here in mechanism of action. But adverse effect and uses is something you cannot, I mean, there is nothing to understand. You have to learn that. So try to make maximum mnemonics and learn it. है ना? Adverse effect में कुछ नहीं समझना. रटो, learn करो, make a mnemonic and learn it. Uses, just learn it. Mechanism of action is something you have to understand. Now coming on the third drug with this overview, coming on the third drug, aminoglycoside. Everyone give me a thumbs up. Can I start the third drug, aminoglycoside? Let's start the third category, aminoglycoside. Why aminoglycosides are known as aminoglycoside? Here the amino groups are linked with the sugars glycosidically. That's why aminoglycosides. That is the structure. So amino groups are linked with the sugar glycosidically. है ना? So it is glycosidically. So this is the structure. Now compare the structure tetracycline, compare the structure of chloramphenicol, rough structure. We will not go in detail. And compare the structure of aminoglycoside. Hana, the name itself is depicting its structure. Tetracycline have 4 rings. Hana, aminoglycoside have a amino group and sugar. They are combined glycosidically. That's why aminoglycoside. Chloramphenicol have a nitrobenzene moiety. Okay, now coming on the classification. Here we don't have any classification, but here we have classification. It is divided into 2 categories. Systemic and topical. Systemic matlab injectable. It is given via injections. It is given intramuscular injections or injections. It's never given oral. No aminoglycoside is oral. No aminoglycoside. There is no tablet available of aminoglycoside. Either they are injectable, either, or topical. Topical means in the form of the ointment or drops. drops or ointment, but it's not a tablet. Please learn. Aminoglycoside is not available in tablet form. It is not available orally. So systemic is injectable and topical. So systemic are 7. 1, 2, 3, 4, 5, 6, 7, 8. 8. I'm having a mnemonic for 8. Huh? So the mnemonic is TANG. T-A-N-G. TANG. Double S. KP. You can make some better mnemonic and share with me also if you have something better. Okay. So these are the 8 systemic. T stand for tobramycin. Okay. I'm sorry. T for tobra. Okay. A stand for amikacin. N stand for netlimycin. G stand for gentamicin. There are 2 S. Streptomycin and cesomycin. K for kanamycin. And P for paramomycin. So TANGs KP. And topical we are having only 2. FN. NF or FN. You can make some mnemonic. Neomycin and pramycin. We have ointment. This one is available as ointment and this one is available as eye drops. Neomycin eye drops are available. So this is drops or ointment. Say yes if you got it. Can you say it once? So total 10 aminoglycosides are there. Total 10 aminoglycosides are there. Out of them, 8 are systemic and 2 of them are topical. Can we learn? Can we learn? Kindly provide some. Okay, Stanks KB. Yes, Pradeep, this is better one. Stanks KP. Thank you, Pradeep. Thank you. Stanks KP. You can learn. These are the 8. Hana? Stanks KP. And here FN. NF or FN. Whatever you learn. So can you see the full form once? Only once. So there are 2 S. Streptomycin, cesomycin. There are 2 S. Tobramycin, amikacin. This is not neomycin. This one is neomycin, but this one is netlimycin. Gentamicin, kanamycin, paramycin. And this one is pramycin and neomycin. So you get questions on that. Please learn. Please learn. So this is the classification. Now see the classification. Here we were having 7 tetracycline. Here we are having 10 aminoglycoside. You know 7, 3 plus 2 plus 2. You know the names, I guess. And here 8 plus 2. You know the names, I guess. And here we don't have any classification. That is chloramphenicol. That is the only drug. Now coming on spectrum. Spectrum. See, it was broad spectrum. This was also broad spectrum. Here it is acting only for gram-negative bacilli. It is acting only for this category, gram-negative bacilli, not for cocci. Neither gram-positive cocci, nor gram-negative cocci, nor gram-positive bacilli. It is having a limited spectrum. That is gram-negative bacilli. Usme bhi sirf aerobic wala. Only aerobic gram-negative bacilli, to be specific. It's very narrow spectrum. It's not broad spectrum. It's narrow. It kills only gram-negative bacilli, that too aerobic. That is aerobic gram-negative bacilli. That's it. Not other drugs. Not other drugs. Say yes. So this is the spectrum. Now coming on mechanism of action. It inhibits first step, initiation. It inhibits the P window. P window. So it inhibits the P window. Can you see it? Blocked P window. It blocked P window. That's why it inhibits the first step, that is initiation. The first step, initiation, is inhibited. The first step, Hana, and it binds with 30S also, 50S also, and junction also. Now compare. This one was binding with 30S. This one was binding with 50S. This one is binding with 30S also, 50S also, and as a junction of 30 plus 50S. This one was inhibiting A window. That is step number 2. This one was inhibiting P to A transfer. That is step number 3. This one is inhibiting P window. That is step number 1. I hope you know the steps. If you have missed my initial lecture from the beginning today, please watch it later after the live session is over. Please watch it. Don't miss it. You can understand the number of the step I'm talking about. Okay. So please understand this is the mechanism of action, and this one is both bacteriostatic as well as Sidle. This one was only static. It was inhibiting the growth, not killing. This one was also inhibiting the growth, not killing. This is inhibiting the growth also as well as killing also. So bacteriostatic as well as Sidle. Say yes if you got it. Say yes. Now coming on the adverse effect. I will give you a mnemonic. What is the adverse effect mnemonic? For aminoglycoside, the mnemonic is on HT. On HT. O double N on. So O is autotoxicity. It is autotoxic. Autotoxicity always means, you know, inside the ear we have 2 things. What is the function of the ear? Why God has provided this organ as the ear? Inside which there are 2 structures. We have cochlea. Cochlea. It is useful for hearing. You know, we have a cochlea, 2.5 ton, which is useful for hearing. And we have vestibule. You know, 3 semicircular canals are there. Vestibular apparatus. Vestibular apparatus. That is 3 semicircular canals. That is for balancing. So ear is required for 2 things. Number 1, hearing. We hear with our ears. And number 2, we do the balancing. If something, you know, the floor is not uniform. If I'm falling, I will immediately hold something. I'm having a balancing, you know, sense of balancing. So balancing is done by the vestibular apparatus. So whenever I say autotoxic, your question should be, ma'am, cochleotoxic or vestibulotoxic? Is it cochleotoxic or vestibulotoxic? I taught you the first drug. What is the first drug I taught you today? Tetracycline. What were the adverse effect of tetracycline? LK Advani. LK Advi. PT teacher. है ना, PT teacher. So Advi का V क्या है? What is V? It is vestibulotoxic. So this one was inhibiting vestibulo. This one is inhibiting both. I mean, it is toxic for cochlear also, vestibulo also. So tetracycline cause problem in the balancing. So patient have vertigo, but this one have vertigo also and deafness also. So it causes deafness also and vertigo also. It is both toxic. That's what I mean. If you got my point. So it is both toxic. Aminoglycoside are cochleotoxic as well as vestibulotoxic. है ना? The point is that cochleotoxicity is irreversible. Once you stop the drug also, it's irreversible. But vestibulotoxicity is reversible. Once you stop the drug, in the next few months, it will be reversible. So never give aminoglycoside in high dose or for more days, as and when required. So you should calculate the dose according to the weight of the patient, according to the GFR of the patient. Then only you have to give in that particular dose. If you are giving more aminoglycoside in higher dose or for more days, prolonged period, patient can become deaf, bilateral deaf. And it is irreversible. Once you stop the drug, the patient will not hear again in life and patient will kill you, patient will sue you. So please beware, never give aminoglycoside in higher doses. So give it on lower doses only, the prescribed doses. Say yes, this is the reason. Okay, so autotoxicity mein both toxicity is there, in which the cochleotoxicity is irreversible, but vestibulotoxicity is reversible. N, there are two N. One is nephrotoxicity, kidney damage, it's reversible. And third is neuromuscular blockage. Neuromuscular blockage, patient can have weakness. Okay, acetylcholine receptors. Okay, so neuromuscular blockage. H is hypersensitivity. Hypersensitivity is caused by all drugs, that is allergy. And T is teratogenic. Like tetracyclines only, it's teratogenic. So on HT, this is the adverse effects. Okay, the adverse effects are on HT. You can compare the adverse effects of the three drugs. LK Advi PT teacher, that is tetracycline. Big super hyper, that is for chloramphenicol, and on HT is for aminoglycoside. In the end, we will say the full forms again. Now coming on the uses. For uses, unfortunately, I don't have any mnemonic. You have to learn here. So uses of aminoglycoside. The uses is like this. You can learn. For gram-negative infections we give, because it is active only for gram-negative bacilli. It is active only for gram-negative aerobic bacilli. So we give only for those infections. So gram-negative bacilli infections, number one. We give it in TB also. We give it in intestinal antisepsis also. We give in tapeworm and MBBS parasitic infections also. And for topical application in the eye drops, neomycin, framycin we give. Okay, Hannah, for conjunctivitis we give. So these are the uses you can learn. Okay, basically it is for gram-negative bacilli if you want to learn the main use. Okay, coming on the last one, erythromycin, then we will compare. Coming on erythromycin. Erythromycin is one of the macrolide. What do you mean by macro? Macro means big. So here the ring is very big. Macrolactone ring is there with multiple attached sugar. Can you see the ring? It's not a benzene. Can you see? Benzene is a 6-carbon ring. It's multiple carbon. Can you see the big ring at the center and the multiple sugars attached that? So it is known as macrolide because it is a big ring with multiple sugars attached. That is the meaning of the macrolide. What is the classification? Here we are having 5 drugs. What are the 5 drugs? Erythromycin, roxithromycin, clarithromycin, azithromycin, spiramycin. Okay, and nowadays tacrolimus. Tacrolimus is not an antibiotic. It is an immunosuppressant drug. But this one is also a macrolide. But in antibiotics, you can learn these 5 names. You can make some mnemonic, and if you have some mnemonic, you can give it to me. Make CAR, ES CAR, SE CAR, SE CAR. Or you can make some better one if you have. Okay, so we are having erythromycin, okay, spiramycin, clarithromycin, azithromycin, and roxithromycin. Or you can make some better mnemonic, and if you have some, raise T. Someone is giving the mnemonic, raise T. Pradeep, very good. You are good at mnemonics, Pradeep. Okay, good one. So raise T. You can learn that also. Okay, so whatever you learn, the 5 you have to learn raise T. So you can write down raise T here. I like that. Raise T. So these are the 5 macrolides. Among them, erythromycin is the prototype. What is the spectrum? Okay, we will revise the spectrum. Everyone on the screen, come. Tetracycline ka spectrum kya tha? What was the spectrum of tetracycline? Say, ma'am, all 4. What are the 4 categories? Say, ma'am, gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. What was the spectrum of chloramphenicol? Say, ma'am, again all 4. The same 4, all 4. What was the spectrum of aminoglycoside? Say, ma'am, only gram-negative bacilli. Only gram-negative bacilli. So the other 3 were not feeling good. The other 3 were feeling bad, that we are not included here. So the last category, we included the other 3. You got my point? See, except gram-negative bacilli. Except gram-negative bacilli, the other 3 are included here. That is gram-positive cocci, gram-negative cocci, and gram-positive bacilli. But not gram-negative bacilli, which was included here. And these 2 categories include all 4. This is the easiest way you can learn the spectrum. This is the easiest way you can learn the spectrum. Okay, Shivam, you can learn the doses in the tabulated form in the end. In the end, I can give you the table, tabulated form, the doses for the children, the doses for the adults. Hana, in the children, they are hardly given. In the adults, you can learn the dosings properly. Okay, the main thing is the mechanism of action, uses and adverse effect. On which maximum MCQs come. है ना, dosings पे ज़्यादा MCQ नहीं आते हैं, but if you are preparing for your second Prof University exam, then you have to write dosings also. Okay, got my point. Now see the spectrum, compare the spectrum of all four. Now coming on mechanism of action, it inhibits the last step, step number 4. That is translocation. Translocation, in which the ribosome is jumping by one codon. So it is inhibiting A to P shift, in which the ribosome is jumping by one codon, that is A to P shift. Got it? So it is A to P shift. You can see here is the cross, A to P shift. The ribosome is jumping by one codon. That is, it is inhibiting the translocation wala step, that is A to P. And it acts on the 50S. Now compare. Now see, don't change the sequence. If you don't change the sequence, tetracycline, chloramphenicol, aminoglycoside and erythromycin, things are super simple. If you change the sequence, you will get confused. Tetracycline act on 30S. Please learn it by heart. Tetracycline act on 30S. Chloramphenicol act on 50S. Aminoglycoside act on both. 30 also, 50 also, junction also. And erythromycin again act on 50S. Please, you get questions on that. Learn. Now learn what they are blocking. Tetracycline block A window. Okay. This block A window. Chloramphenicol block P to A shift. Okay. Aminoglycoside block P window. And this erythromycin block A to P shift. Now you can understand. This is the easiest way I'm telling you. And you know the step number also. Which exact step number they are blocking. Say yes if you got it. This is also bacteriostatic. This is also bacteriostatic. This is also bacteriostatic. Except aminoglycoside. They all are bacteriostatic. Aminoglycoside is both bacteriostatic as well as acidic. Got my point? Now coming on adverse effect and uses, I will give you 2 mnemonics. So coming on the adverse effects of the erythromycin. Adverse effect. The mnemonic is macro. What is macro? M-A-C-R-O. Macro. M stand for motilin receptors. It is a motilin receptor agonist, not antagonist. It is agonist. You will say, ma'am, what are motilin receptors? So in the esophagus, stomach and the intestine, there are certain receptors which are known as motilin receptors in the GIT. We all have that receptors. We all have that receptors. What does these are known as motilin receptors. So whenever we are taking erythromycin, the erythromycin will go and do the job of, it is stimulating these receptors. It is agonist for these receptors. These receptors, once stimulated, they will do the peristalsis. So patient can have diarrhea. Patient can have diarrhea. Got my point? So motilin receptor agonist is there. Motilin receptor. M for motilin receptor agonist. M-A. A is for allergy. Allergy is hypersensitivity. I told you, no, allergy or hypersensitivity is there in all antibiotic. It's a side effect. C is cholestasis. That is jaundice. It causes jaundice also, cholestasis. And RO is reversible autotoxicity. So it is also autotoxic, but this time it's reversible in contrast to aminoglycoside where autotoxicity was irreversible. So I taught you autotoxicity in 2 drugs. I taught you autotoxicity here also and here also. Here it's irreversible and here it's reversible. Got my point? Here was O was autotoxicity. On HT ka O is autotoxicity. और यहाँ पे macro का O. See, O is coming here also, O is coming here also. Both O are autotoxicity. But this one is irreversible, this one is reversible. So that is macro. And the uses is CLAW. The mnemonic of the uses is CLAW, CLAW. C stand for 3 things. That is chancroid, caused by Haemophilus ducrei. It's a STD. Okay, it's a STD. Corynebacterium diphtheria. Okay, and Campylobacter. So chancroid, Corynebacterium, and Campylobacter. These are the 3C. L for Legionella. A for atypical pneumonia and W for whooping cough. Whooping cough is caused by Bordetella, we all know. So that is the side effects and uses. I hope you all got it. See, now compare the side effect, compare the uses. The main thing you have to learn, this is the master table. First, everyone give me a thumbs up if you got this master table. If you have missed the lecture from the beginning, please watch it after the live session is over. Please, you can't afford to miss it. In the same way I am teaching you, I'm going to teach you entire pharmacology like this. Entire pharmacology. In the entire pharmacology, we are having 100, 120 drugs. So we can make tables, chapter wise. All the protein synthesis inhibitors are there. Now the next session I'm taking beta lactam. So I will give you a comparative table of the beta lactam. All the beta lactams at 1 page. Okay. Now then I will teach you the, anti-metabolic and antibiotics. So we will take them on 1 page. So all the CVS drug on 1 page, all the antihypertensives on 1 page. In this way, we can combine. In the end, we will be having 20 to 25 pages, entire pharmacology compacted. The headings will remain same. For all pharmacology, my headings are same. This is the way you should read. Pharmacology. You will never forget. In the end, before going to your exam, whatever exam you are targeting for, just read that master tables. I call them master tables. So try to make master tables of entire pharmacology like this only. This is the way you should learn pharmacology. Otherwise, it's a very volatile subject. You will read it today, tomorrow you will forget. If you don't make the mnemonics for adverse effect and uses, you will forget. If you have the mnemonic, there is a chance you will forget, but there is a chance you can remember also. You will think, na, L hai to L kuch to hoga. What does this L stand for? So you may have a clue ki L may be liver damage. So you can have a, like, you can have a clue like that. So if you know the mnemonic, it's better. Otherwise, you cannot learn the adverse effect and uses of all the prototype drugs. And try to learn the prototype drugs in this way only. Got it? Say yes. Now, please see the adverse effect of all four. Okay? Here, LK ADV PT teacher. Here, big super hyper. Okay? Here, it's on HT. Here, it's macro. You want me to say the full form or you will learn by yourself? And see the uses of all four. See the uses. Here, it's vacuum, bedroom 2. Here, Bayer TB. Here, claw. So, please say the full form. To say to your friend, write it down on a paper and stick on the wall. And aate jaate usko dekhte raho, bolte raho. Learn the spectrum. Learning spectrum is very easy. Very easy. These two are broad spectrum. These two are narrow spectrum. In the narrow spectrum, you should be specific against which category it's functional. And the ultra important, which you cannot miss, you have to learn the mechanism of action. In the mechanism of action, you have to learn which ribosome it is acting. Tetracycline on 30S, chloramphenicol on 50S, aminoglycoside on both, and erythromycin again on 50S. Which window they are blocking? Aminoglycoside blocking A window, chloramphenicol blocking A to P shift, it's P to A shift, blocking P to A shift, aminoglycoside blocking P window, and erythromycin blocking A to P shift. So you have to learn that window. And which one is bacteriostatic, which one is bactericidal. All of them are bacteriostatic except aminoglycoside, which is bacteriostatic as well as acidic. You have to learn the classification. I assume classification you already know. And structure, if you don't learn also, it's okay. Structure is, frankly speaking, not important. They don't ask you the structure. But this is a way you have to learn. Okay, I will take sessions, more and more sessions on the YouTube. Okay, so you can text the topic you want from my side. I will give you a contact number on which you can send the text. And if I'm getting many messages on the same topic, many requests by the students on the same topic, I will conduct that on the YouTube. Okay, so this series is never ending. On YouTube, we will be live every Monday, every Wednesday, and every Friday, 9:30 a.m. in the morning with the topic on demand. Whatever topic you demand, we will present here. Okay, anyways. So this is the master table. Everyone got it? Give me a thumbs up if you got it. If you have got this master table, you are ready to solve the MCQs. Apply the mnemonics and solve the MCQs. Let's see some MCQs. The first question is in front of you. Which of the following is a side effect of streptomycin? First, you tell me what is streptomycin? In which category it is coming? Is it a tetracycline? Say no. Is it a chloramphenicol? No. Is it macrolide? No. It is aminoglycoside. How many type of aminoglycosides I told you? I told you aminoglycosides are total 10. 8 of them are systemic and 2 of them are tropical. So systemic, I told you the mnemonic for the systemic we have learned Stanks. Stanks KP. Stanks KP ka one of the S is streptomycin. In this we first recognize the drug. Pehle the drug ko recognize karo in which category it is coming. And the tropical one were NF. है ना? So it is aminoglycoside. They are asking the side effect of aminoglycoside. Use your master table. They are asking the side effect of aminoglycoside. The side effect is on HT. The side effect is on HT. Okay. So write down the mnemonic here and apply it on HT. Okay. Autotoxic. Okay. Autotoxicity. Nephrotoxicity and neuromuscular blockage, hypersensitivity and teratogenic. Now have a look on the option. Phototoxicity is coming here. No, it's not coming. Hepatotoxicity is coming here. No, it's not coming. But autotoxicity is coming. So answer is C, not D. Answer is C, not D. Say yes if you got it. Say, why you are not giving the answer? Please write down the answer in the chat box, please. You got it? This is a way. Here is how we applied the mnemonic. So first learn the mnemonic, learn the full form of the mnemonic and try to apply it in the questions as much as you possible so that it will be easy for you. I know. So coming on the next question, tetracycline inhibit protein synthesis by what? They are asking the exact step. The first tetracycline. Does it inhibit initiation? Does it bind to the 30S and inhibit the binding of new amino acyl tRNA? Does it inhibit the peptide-peptide bond formation or does it inhibit the translocation? So these are the 4 steps. This is step number 1, this is step number 2, this is step number 3 and this is last step number 4. So which step it is blocking? I told you there are 4 steps. Now, which exact step it is blocking? Can you give the answer in the chat box, anyone, if you know? So I told you it blocked the second step. It bind with the 30S and it blocked the A window. It blocked the A window, so new amino acid cannot come on that. So correct answer is B. Hana, if I change the same question, instead of tetracycline, if I do aminoglycoside, so answer is 1. It inhibit initiation, step number 1. If I change the question to chloramphenicol, answer will become C. It inhibit peptide bond formation, step number 3. And if I change the question and do erythromycin or any of the macrolide, azithromycin, roxithromycin, so answer will become D in that case. In that case, answer will become D. You all are right, absolutely right. So I'm creating 4 MCQs here. I have given only 1, but 4 MCQs can be created. The options will remain same. If I change the any drug in the question, I will not give you aminoglycoside. I will give you a particular drug. I will ask kanamycin. I will ask paramycin. So you should identify it's a aminoglycoside. So I am judging 2 things, whether you know classification, yes or no, and you know mechanism of action, yes or no. Got it? Coming on the next question. The next question is in front of you. Tetracycline inhibit protein synthesis by acting on which segment of the ribosome? Tetracycline act on 30S, or it act on 50S, or it act on both, or it act on 60S. Where does it act? So I told you through 4 drugs now. Tetracycline, chloramphenicol, aminoglycoside, and macrolides, that is erythromycin. So I told you this one act on 30S, this one act on 50S, this one act on both 30, 50 and junction, and this one act on 50S. So what they are asking for tetracycline. So answer is 30S. Answer here is 30S. But if I change the question to chloramphenicol, answer will become 50. If I change the question to any of the aminoglycoside like streptomycin or any of the aminoglycoside, answer will become 4. Both. Answer will become C. So in this way, you should be able to answer all. ऐसा नहीं है कि question ये आया है तो हर बार tetracycline पे ही पूछेंगे. The last year they asked tetracycline, but every year they will not ask tetracycline. It is a topic which is important. You should be prepared for all questions. Got it? So it's important. Please learn. The next is gray baby syndrome. Where it is coming? Gray baby syndrome is caused by which drug? So it is the side effect of which drug? So it is a side effect of chloramphenicol. The mnemonic I told you is big super hyper. Big super hyper G stand for gray baby syndrome. The G is standing for gray baby syndrome. It is bone marrow toxicity, the most fatal side effect. I is irritative. G is gray baby syndrome. This is super infection. This is hypersensitivity. So answer is chloramphenicol. Got it? The correct answer is chloramphenicol. The next question, what is the mechanism of action of streptomycin? What is a streptomycin? First tell me the category of the drug it is belonging. So it is one of the aminoglycoside. One of the aminoglycoside. है ना? Stanks KP का S है. So it is one of the aminoglycosides. So what is the mechanism of action of aminoglycoside? Does it inhibit translation? Does it inhibit signal transduction? Does it inhibit citric acid cycle? Or does it inhibit mitochondria? The question is very simple. We know aminoglycoside are protein synthesis inhibitors. So they inhibit translation. They inhibit translation. The correct answer is A, and you all are right. The next question is in front of you. Which of the following aminoglycoside is not available for parenteral use? I told you total 10 aminoglycoside. The question is based on classification. Out of which 8 are systemic. Systemic means parenteral. Okay. And 2 of them are topical. So what they are asking, see, how many of them are systemic? 8. What is the mnemonic? Stanks. Stanks KP. And here the mnemonic is NF. They are asking which of the following is not systemic. Which of the following is not parenteral? Parenteral means systemic. So which of them? So cesomycin is coming here. Amikacin is also coming here. You can see this is amikacin. And gentamicin is also coming here. But you can see framycin is coming there. So framycin is available for topical use. It is not available for systemic use. It is available as the ointment. So correct answer is C. In this way, you get easy questions. If you know it, it's very, you know the classifications, you know the mnemonics, it's very easy to crack pharma. Which of the following is the side effect of streptomycin? Streptomycin is again an aminoglycoside. What is the mnemonic? On HT. On HT. Okay, it's a repeat question, I guess. Okay. Which of the following acts on the motilin receptors? Is it erythromycin, tetracycline, norflox, or chloramphenicol? Motilin receptors kahan aa raha tha? Yes, the correct answer is erythromycin, which is one of the macrolide. The mnemonic is macro. The mnemonic is macro. These are the side effects. It is motilin receptor agonist. I'm sorry, M stand for motilin receptor agonist. This is allergy. This one is allergy. This one is cholestasis, that is jaundice, and reversible ototoxicity. So correct answer is erythromycin. If you want the notes along with the master table of this, it's available. The link is given in the chat box. If you see the chat box, there is a link given at the initial where the chat is starting, and the link is pinned. If you click on the link, you will be diverted towards the notes. Not only this notes, all my YouTube session notes which I am taking in this series, the live sessions on the YouTube, the notes are available there. So you can read there, you can copy, you can make your notes, you can read from there. The notes are available. Okay. And thank you for your kind attention, your time. If you like the session, don't forget to click on the like button, share with your friends, colleagues, everyone. Those who want to crack pharmacology, please share this link. Okay. And those who want to understand how to read pharmacology. Students ask me, ma'am, padhna kaise hai pharma? We forget. We read, we forget. So this is a way you should read the pharmacology. Making master table is the only thing you can learn the pharmacology. Okay. Now here is a QR code given to you. You can scan it. You will be diverted towards our website, that is medlive by drpriyanka.com, where you can connect with me on various social media platforms, that is Instagram, Telegram, WhatsApp group, where I share, more and more study related material for your exams with you. Okay, of multiple subjects. And here is a contact number given to you, that is 9321 001485, on which this is for chat support, on which you can ask your queries related to any of the subject which I am teaching, or you can text me the topic on demand which you want by my side you want me to take on the YouTube. You can text that topic also. If I'm getting multiple requests on the same topic, I will schedule it soon on the YouTube. Thank you so much. Every Monday, Wednesday, Friday in the morning we take a live session at 9:30 a.m. in the morning, every Monday, Wednesday, Friday. So today we took a session on the protein synthesis inhibitor, the 18th of December. The next is on 20th of December. So on 20th of December, on Wednesday, I will see you again with beta-lactam antibiotics in the same master chart tabulated manner. So don't dare to miss that session. It will be very useful for all of you. And thank you so much for being with me. Thank you. Thank you for your compliments, for your comments. Thank you so much. So hope to see you again. So Wednesday morning, every Monday, Wednesday, Friday, 9:30 a.m. in the morning. And if you have any topic in your mind and you want me to take it on YouTube live, you can text that topic on that contact number which I have provided to you. Okay. Thank you so much. Bye-bye. Wishing you all the best. Bye. I'm ending the session.